Topiramate is a medication that is used on its own or in combination with other medications to prevent and control seizures, also known as epilepsy. It is also used to prevent migraine headaches and reduce their frequency. However, it will not treat a migraine headache once it occurs. If you do get a migraine headache, make sure to treat it as directed by your doctor, such as by taking pain medication and resting in a dark room. Topiramate is classified as an anticonvulsant or antiepileptic drug. The daily dosage and optimal timing for taking topiramate should be determined by your healthcare provider. When starting topiramate, it's important to read the medication guide and patient information leaflet provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually twice daily. Swallow the tablets whole to prevent a bitter taste. To prevent kidney stones, drink plenty of liquids unless instructed otherwise by your doctor. The dosage of topiramate is based on your medical condition and response to treatment, and for children, it is also based on weight. Your doctor will gradually increase your dose to reduce the risk of side effects. It may take several weeks or months to reach the best dose for you and to get the full benefit from this medication. Take topiramate regularly at the same times each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. If your condition lasts or gets worse, be sure to tell your doctor. If you experience tiredness, drowsiness, dizziness, loss of coordination, tingling of the hands/feet, loss of appetite, bad taste in your mouth, diarrhea, or weight loss, you may experience some common side effects of topiramate. Mental problems like confusion, slowed thinking, trouble concentrating, nervousness, memory problems, or speech/language problems may also occur. Remember, this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. If you experience any serious side effects such as signs of kidney stones, rapid breathing, irregular heartbeat, bone pain, broken bones, loss of consciousness, unusual bleeding/bruising, depression, suicidal thoughts/attempts, or any unusual changes in mood, thoughts, or behavior, contact your doctor right away. In rare cases, topiramate may cause a serious eye problem, so seek medical help immediately if you experience sudden vision changes or eye pain/redness. It can also rarely cause a serious metabolic problem, especially if you are also taking valproic acid. If you experience sudden/unexplained tiredness, vomiting, or mental changes, contact your doctor immediately. While a serious allergic reaction to this drug is rare, seek medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed above, contact your doctor or pharmacist. If you're in the US, you may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before taking topiramate, it's important to let your doctor know if you have any allergies or if you are allergic to it. It's also important to tell your doctor about your medical history, especially if you have certain eye problems, kidney or liver problems, mental or mood problems, lung or breathing problems, certain metabolic imbalances, or if you are on a specific diet. This medication may cause dizziness, drowsiness, or impair your judgment, so it's important to avoid activities that require alertness until you know how this medication affects you. It's also important to avoid alcohol and marijuana while taking topiramate. Topiramate may also make you sweat less, which can increase your risk of getting heat stroke. It's important to avoid overheating and to stay hydrated, especially in hot weather. Before having surgery, make sure to tell your doctor about all the medications and products you are using. Children and older adults may be more sensitive to the side effects of this drug, so it's important to consult your doctor or pharmacist for more details. If you are pregnant, planning to become pregnant, or breastfeeding, it's important to discuss the use of this medication with your doctor, as it may harm an unborn baby or have undesirable effects on a nursing infant. Now, let's talk about the possible interactions of topiramate with other drugs. It's important to know that this medication may decrease the effectiveness of hormonal birth control products, such as pills, patch, or ring, which could result in pregnancy. It's best to discuss with your doctor or pharmacist about using additional reliable birth control methods while taking this medication. Also, it's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, including alcohol, marijuana, antihistamines, drugs for sleep or anxiety, muscle relaxants, and opioid pain relievers. Always check the labels on all your medicines because they may contain ingredients that cause drowsiness, and ask your pharmacist about using those products safely. And that's it for the possible drug interactions with topiramate. If someone has taken too much topiramate and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe drowsiness and loss of consciousness. It's crucial to get help right away in these situations. It's important not to share your topiramate medication with others. Your doctor may also want to monitor your health with lab or medical tests, like eye exams and checking your bicarbonate blood levels. So make sure to keep all your medical and lab appointments while taking this medication. If you forget to take a dose of topiramate, take it as soon as you remember. However, if it's within 6 hours of your next scheduled dose, it's best to just skip the missed dose. Don't take extra medication to make up for the missed dose. If you happen to miss more than one dose, it's important to contact your doctor for guidance. When storing topiramate, make sure to keep it in a tightly closed container at room temperature, away from light and moisture. It's important not to store it in the bathroom and to keep it out of reach of children and pets. When you no longer need the medication or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do so. Remember not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.